Hello, beautiful people. This is my 28-week update, and I am officially going to be 7 months, a couple days. So the last update I did was at 22 weeks, and on this Wednesday, this week right here, I was 27 weeks and 4 days, and I went to see my general OB and then the maternal medicine doctor as well. I went to see them today. At my OB visit, my 28 week visit, I had the Tdap vaccine done. I'm not a fan of the vaccines. I probably won't be opting into anymore. This is just one that I did because I was the one getting it and not the baby. But anyway, I got that done. As far as symptoms, my arm is still very sore, and I don't think I've had any more symptoms or reactions to it. I'm not sure about the baby, but I also had the glucose test done. So if I did have any symptoms from it, I wouldn't really know which one it was from. Yeah, no fever or pain except at the injection site, and I still have a little bit of soreness today, but other than that, nothing. I also signed my consent form this week at my OB, and that was for a blood transfusion. So I had to sign that consent form in case, I was to need it, during delivery or anything like that. So at this visit, 28-week visit, I'm going to go ahead and call it 28-week visit, which is the beginning of the third trimester. We talked about delivery options, water birth, epidural, different facilities that will be available to me. I'm also going to be making some appointments to visit some of the facilities just to see what's going on and which one I like the best. My blood pressure and my heart rate was normal range. The baby was being a busybody, so we weren't really able to get the heart rate from them. And like I said, I also had the prenatal glucose screening done, which tests for gestational diabetes. The test is usually done between 24 and 28 weeks. And like I said, I am 27. Yesterday, I was 27 weeks and 4 days. So what they do is have you drink 50 milligrams of a sugary drink. And I had the fruit punch flavor, which wasn't too bad. I had to drink it within 5 minutes, and then I waited an hour, and they tested, they drew my blood after that hour. I got my results back today. My level was 135, which is technically normal according to some doctors. Now, different doctors have different thresholds. Some is between 65 and 139, and some only want to go as high as 130. My last pregnancy, when I had this done last year, my level was 120. So it was better last year. It's a little higher this year. Now today I had my visit with the maternal care doctor. And of course, that's the doctor you go to get your full anatomy scan if you're over a certain age, or if there are any, high risk things going on with you, then you would go to that doctor to have your full scans every month. And today just happens to be the day that I went, which was right after the OB appointment. So it kind of worked out really well because they can kind of, give feedback to each other about my results. So, during the anatomy scan, he saw some extra fluid, some extra amniotic fluid. And because of that and the fact that my level was 135, which is kind of like on the border, he wanted me to go ahead and do the 3-hour glucose test, which I'm not a fan of. I don't want to do it. I don't plan to do it. I don't want to do it. And that's because of when I did the 1-hour test, glucose test yesterday, I noticed that the baby's movement decreased a lot. And I was reading up online, and I saw that a lot of people said that, yeah, they noticed that after the glucose test that the baby's movement decreased a lot. And I don't like it at all because I'm used to my child moving around. I know the schedule, I know the routine, and that's what I want, and that's what I'm used to. I don't want anything affecting, this child in any way. They suggested, like I said, a 3-hour, but I was adamant against that. I don't want to do that, so I asked for an alternative, and the alternative is for me to check my glucose level 4 times a day. So what that's going to consist of is me checking it early in the AM, so fasting, and then me checking it 2 hours after each meal. So that would be, breakfast, lunch, dinner, and that would make the 4 times a day. And then I just have to track that and monitor that. My A1C has been teetering 5.6 to 5.7, over the past couple years. So I am on the pre-diabetic threshold there. But this did alarm me a little bit in conjunction with my glucose, being 135. So I know I need to actively get back to exercising and walking, eating right, less bread, less starch and things or whatever that's going to turn into sugar. I know I need to do better. But as far as the extra fluid is concerned, I'm sure that me doing better with the sugar intake and exercise is going to reduce that, because that can affect it. Resting too much can affect it. And of course, if I'm not exercising, that would mean I'm resting. So I'm eating and then, not working, or, working that off. So I'm not burning that excess sugar off. So yes, I know I need to get on the ball. I'm going to get on the ball. And a lot of these things are probably playing up to that. In addition to the fact that if you drink a lot of water, you add to a lot of fluid. But like I said, both of those things together, the fluid and the level, made him a little concerned and made him want to suggest that I get the 3 hour. But I am not feeling the 3 hour because of how the 1 hour affected the baby. And I want this to go as smooth as possible. I don't want any extra fluid. I don't want anything to affect this child at all. Like I said, I'm going to do everything I can to stop this in its tracks. If you all have any questions, comments, or concerns, about your glucose test and how it went, let me know. I love to hear your experience with that. And I want to thank you all for watching my 28-week update. And here is my little baby bump. Here's the honey bear. So I have about 11 weeks or so to go. I'm not sure if honey bear will track it all the way to that, but we will see. He's actually due on my father's birthday in February, but that would be sweet if he's born on that day. But if not, all we're concerned about is having a healthy pregnancy, delivery, and especially baby. Thank you all for watching. Be blessed.